Let's go ahead and start from the beginning. And what we're going to be covering today is introduction, the nature to EFT. EFT has its roots in 1986, where Sue Johnson and Leslie Greenberg were working together. Sue Johnson took the path of working with couples. Les Greenberg took the path working with individuals. But today, EFT can be used with pretty much any modality or any format or any individuals, couples, families. It can be used for business, for working with in-laws, children. It pretty much covers all the gamut of work. So let's go ahead and start on this and answer a big question. What is the EFT? Well, EFT stands for emotionally focused therapy. And there's variations of it. EFIT, EFCT, EFFT, but it's a short-term therapy. And the short-term means that we should be able to handle most of the cases within 12 to 16 sessions. And the reason is because you may have sessions every week initially, then switch to once every 2 weeks, and then switch to once every 3 weeks, and then you finish the work with the client. It is a short-term, so it applies very good to insurances where we have only available a certain amount of time where we can work with a client. It's systematic. That means it has a beginning and it has an end. It has a path to which we take the clients from dysfunction to reduction of dysfunction and reduction of the stress. We have almost a GPS within the EFT framework that allows us to navigate client in the right direction. Now, when I say GPS, I think it's a very important statement because we don't tell the clients what to do, but we guide them to the better place. That means we will connect with the clients. It's an egalitarian relationship where we're on the same level as the client is. And because of this, we can navigate into client's experience, and we can, if they get off course, we can say, no, turn a little bit to the left, no, turn a little bit to the right, go straight. Right, that's our direction. We're more of a process consultant to the client to help them to navigate through the distress. EFT is also defined as intervention to reduce distress and dysfunction. And emotional focused therapy is an intervention to dysfunction and to distress in a person's life or couple's life or family life. It works well for individuals, and this is really important, that it covers pretty much every gamut of presenting issue with the client, whether it's emotional disorders of depression, anxiety, and post-traumatic stress. EFT works very well with this. There's actually a book written by Sue Johnson for EFT with trauma. But most of the clients that you're going to see will have depression or anxiety or combination of both. Or they will have some post-traumatic stress disorder. The EFT model nicely fits into this configuration. We also work with couples, and that's couples that struggle with love relationships. And that's an important topic because we are working with clients in a romantic relationship. Now, that does not mean that this is the only couple modality that we can work with, because we can also work with a parent and a child. We can work with two friends. We can work with two work acquaintances. There are many different ways that you can manage the relationship with other people and the distress in the relationship using EFCT. And finally, we work with families. Now, most of the time, family work is when we work with a family that has a distressed adolescence. Even though that it's focused on that, and there's actually a workshop for this, Hold Me Tight, Let Me Go, it focuses on this, is to helping the families to recover and work with the distressed adolescents. We can also work with the families that have adult children, and that works very well too. So the EFT is the experiential attachment-based emotionally focused intervention. And there's a specific definition what experiential is, and that is we practice in session. We don't assign homework. Once in a while, we can provide some supporting sheets that they can use for them to remember what they had in the session, maybe to understand the words that we used, maybe the words of a list of emotions. But most of the work, 99% of the work is done in the session with the clients. So when they finish the session and they leave, they don't have to think about doing homework or doing anything that would make them responsible toward their therapist. And the reason is because we know that homework does not associate with the outcome. If people who do homework or people don't do homework, there's no correlation that the outcome will be better. And in addition, we do not want to create a situation where our clients feel obligated to complete certain homeworks and may decide not to show up for the session because they didn't finish the homework we assigned. So it's very gentle model, very forgiving model. And therefore, if we assign small little things here and there, it's okay if our clients don't do them. It is an attachment-based model, and that focuses on innate human need to be connected with another person. This is not something that we develop, this is something we're born. That's a survival tool that we have when we're connected with others. It feels safer, it feels comfortable, and it feels stress reducing. We're going to be talking about John Bowlby and attachment theory. That's going to be part of the training for the next sessions. But right now, the EFT is based on attachment, and that's important because everything that we tell our clients, everything we conjecture to, everything that we explain, everything is based on attachment. And that means that all the things that clients do makes perfect sense because they're fighting for their connection. If they're fighting for their connection, that's attachment based. We can always reframe it and say, of course, you're doing this because you care about each other and you want to be close. Of course, you're struggling. Of course, you're angry. Of course, you're frustrated. Of course, you're dissatisfied because you want to be close to your partner, but you don't know how. That's the type of reframing we're looking for. And finally, it's emotionally focused. We have firm belief as EFT practitioners, and it's an evidence-based that the emotion is the key organizer of our internal experiences, and it's a key organizer for interaction and attachments in a relationship. This is what we need to stay connected with our partners. This is what we need to stay connected to people at work. This is what we need to be connected with the people around us. The emotions will drive our ability to connect with other people. But of course, the emotions can be divided in different categories. Some of them are productive, some are not productive. But nevertheless, they're the ones who create action. And that's why you see couples fighting, because they want to be close to each other, they want to be connected, they have these strong emotions of frustration, disappointment, and they start fight. But in the context of EFT, we get that. We understand it, and we accept it, that this is what's needed to survive. Why focus on emotions? Why not focus on cognition? Why not focus on actions, but focus on emotions? Because we know until we're emotionally safe with our partners, we can't use our cognition, we can't use our brain power, and we can't do things that would make our relationship better. So emotion pulls for and organizes key responses. This is what it does. It helps us to put together a narrative that we're going to tell our partners. And even when we talk to ourselves, even when we have a view of self, emotions tells us a lot about ourselves and how we navigate in our own life, and how we navigate in close relationships, and how we navigate in the world. So for us to focus on emotions is to focus on a foundation that drives us to actions. And it's especially important in the romantic adult relationships because emotions will drive us to do the same things over and over again, even though we know we're not going to get the same result. And it's going to be us as an EFT therapist to help our clients who have tried the same thing over and over again and nothing worked, to try it a little bit different and focus on emotions and put the content of the conversation aside. So EFT is also interpersonal. That means it's relationship with yourself. and interpersonal, that's relationship with others. That's what we call within. You see a lot of that word being used in the next classes. We talk about within. That's what happens inside of you, within you and your younger you, or that hurt you, or frustrated you, and between you and other people. We also talk about within the level of change within you and the level of change between people that you're close with. So in this system, in EFT, we want to focus on changing ourselves and also changing relational system. We refer it as interactional pattern. It's something that causes a lot of couples distress when this interactional pattern doesn't work, and it creates distress. So intrapersonal and interpersonal is part of the EFT, and we're going to be moving in sessions between internal understanding of what our clients' experiences to interpersonal understanding what their experience. And we flow very fluidly between within and between. When we work with our client, we can say, and what is happening for you right now at this moment? And that's part of within. And how did you react to this? And what happened to you? We go into between. And when you hear your partner sharing her experience, how does it land on you? Now we're talking between the clients, right? So this within and between is a natural words for EFT, and we're going to be using it quite a bit as we go through different chapters. But the important part is that we're not only trying to reorganize the pattern of the relational system, we also want to help our clients to understand the change that happens within them and change in how what they do affect their partner, what they do affect their coworker, what they do and what they say and how they say things affects their friends and relatives and the family, right? So that's going to be not only within what they're experiencing in the moment, but in between, and what I do affects other people, and especially the people I care about. So in EFT process, what we want to see and what we're trying to achieve is to understand how clients' habitual ways of dealing with difficult emotions. And when I say habitual, that means repetitive. Repetitive ways the clients deal with difficult emotions maintain those emotional dilemmas. That means most of our clients will be turning on autopilot whenever they get in a situation where they get distressed, right? A lot of times it's very difficult to be deliberate about what's happening. It's very difficult to recognize what's happening with us because we're overwhelmed. And as an EFT practitioner, our goal is to understand how their habitual patterns and habitual ways of dealing with their difficult emotions affect them and how they get stuck in there. Many times during the session, we will tell them, and when you do this and you experience something else and you want to share with your partner, but you don't know how, you get stuck. You get stuck because you tried all the things before and they didn't work. But right here, right now, I'm just stuck. In a way, we guide them to a place where they can understand how their habitual ways of dealing with difficult emotions affect their relationship, affect their self, and affect their partner. And the second part of the EFT process is expanding emotional responses. Most of the time, clients will walk in initially with very few emotional responses, and they're going to be either anger and frustration or dismissal and shutdown. These are more of dichotomous responses. It's black and white. It's either you love me or you don't love me. It's either you care about me or don't care about me, right? But we're going to take it to the next step. In EFT, we take it to a step where they can start understanding their responses and understand their core fears and core needs. That means the client will be able to understand that there are specific fears that drive me in my response when I'm confronted with difficult emotions. And I have specific needs from my partner to feel safe. So implicit fear is usually divided into three categories, and they're fear about yourself, fear about your partner, and fear about the relationship. Right? So during the session, we expand on this, we give them the texture of the experience, and we explore their fears about themselves, about their partners, and about their relationship. And those fears are typically like I'm scared that that I'm not good enough. That would be a fear about yourself, or I'm scared that I'm too much. The fear about your partner could be my partner doesn't see how much I'm scared. My partner doesn't care what's happening for me. There may be other combinations, but there's a lot of fears about our partners rooted in not loving us or not caring about us. And then there's a fear about relationship. A fear about relationship may be that's how we're going to get stuck and we're not going to be able to improve our relationship. This is where we are, and we're not going to get better. Or even worse, my fear is that I'm going to lose you and we're going to separate. And that's going to be the end of our relationship. So there's a lot of existentials, not only core fears, but they're existential fears of basically for their relationship to survive. And the core needs are the need to be connected, and they're straightforward needs. We want to be accepted, want to be understood, and we want to be validated, and we want to be reassured, right? All of these things are innate to us, and we need this to survive. And a lot of times reassurance comes in forms of words, in forms of actions. You can reassure a person by telling them that I love you just the way you are. You don't need to be changed. You're good enough for me. You're not too much, right? That's a reassurance. Or um, giving a person a hug if that's what they need to feel safer, or holding their hand, or sitting next to them, or just being next to each other and not saying anything. There are many different needs, and one of the things that we're going to help our clients is to learn how to express their needs in such a way that their partner can respond to those needs. So the EFT process is also looking at the constriction and rigidity in couples interaction, right? When we come to therapy, most of the time with very constricted view of our emotional experience and constricted and rigid in understanding what can be done. Many clients say, well, that's who I am. That's it. You're trying to change me. That's me. That's who I am. If you don't like me just the way I am, then I cannot change anything. Right. So this is very difficult, a difficult place for clients, right? When they don't have ability to expand and accept different views or different understanding. And our job is to engage with them, right? Process their experience and engage with them in such a way that gradually we can help them to replace the constriction and rigidity with expansiveness and flexibility, right? And expansiveness and flexibility allows them to accept their partner's experience just the way it is, validate their experience, and reassure their partner, and also be flexible enough that if something goes wrong in our relationship, we can come back and resolve this problem. And be flexible enough that if I'm angry, I affect my partner, and I can look within and see what I can do to help not to have this reactivity, right? So there's lots of flexibility comes, and that's what our process does. That's what we do as a therapist to help our clients to navigate through their experience and cross over from the constriction and rigidity into the expansiveness and flexibility. So from cultural competence point of view, EFT is been tested across different modalities. It's been tested with and used with Christian couples and families, Orthodox Jewish couples and families, gay and straight couples, less educated, more intensely educated population. It's been validated across individual therapy, pretty much against most of the diagnoses. We're having DSM, nearly every diagnosis designated problem in mental health. There's one exception, or several exceptions, which is EFT is contraindicated, and this if your client has schizophrenia or if there's an antisocial personality disorder. And the reason is because with antisocial personality disorder, we're teaching your clients something that they can use to hurt other people. So, and they won't be able to respond to to emotional cues. And in schizophrenia, of course, that's a difficult part. It needs to be controlled for the therapy to work. Okay. There's some, of course, we don't forget about the domestic violence. So you have to assess for safety in the couple's relationship. But barring that, we can also work with clients with the drug addictions. We can work with the clients with alcohol addiction, weed addiction, porn addiction, gambling addiction. All of these fall squarely into the competence of the emotionally focused therapy. That's what's so exciting, that with emotionally focused therapy, as the clients walk in, we have a confidence and comfort that we can help them, that we can help them to recover their distress, rebuild their life, develop a healthy relationship, rebuild their relationship, and thrive instead of suffering. So why EFT? I think it's a good point, the question, because a lot of people say, especially when they come to training, I'm using CBT, been using it for a while. I'm using maybe narrative therapy, maybe psychodynamic analytical therapy, and why do I need the EFT? And EFT has advantages over many other therapies because, number one, it's a brief treatment. It's a brief treatment, and therefore it fits very nicely with the insurance requirements. And it also helps clients to know the beginning, middle, and the end, right? We can tell them, here's the 3 stages. We can start here. We begin the therapy. There's a middle stage, and then there's an end stage, right? So there's a lot of fears removed when the clients feel that they're not stuck in the therapy for the rest of their life. The second thing is that EFT has been rigorously tested. It's been systematically described in details, and it produces consistently positive results. And that's what's so important, that across all the modalities and tests and research, every research shows that the results are positive. Then maybe there is variation at the level of the results, but the outcomes are always positive. And that's so nice to walk into the session and work with the clients and know that the outcome of the session will be positive. There's a expression that we use a lot in EFT, and that is, it's better to have some EFT than no EFT. And some EFT is important. And we're going to talk about what it means to have a little bit of EFT. But many of the things, as a therapist, you already know. You already know that you need to attune to the client, stay present with the client, reflect, be empathetic, right? But the EFT will take it to a new level. We talk about relentless empathy, right? And that's gonna take time to learn and accept and marinate in it, to feel and understand what it's like to provide relentless empathy. So there's also relapse is not a significant issue with EFT, and that's a big deal. But if you work with clients and they leave and they relapse back in the original behavior, that's not going to make it very easy for them to come back and do another therapy session. How many times I have clients who come in and they say, we've already seen a couple of therapists, it helped a little bit, but we're back into the same problem, we're back in the same issue, right? The goal for us is to see our clients, and they live, after they see us, they go and live their lives. Once in a while, if they get into a difficult situation, they can come back and hope maybe to resolve one issue that's kind of bugging them. But that's it. Once in a while, they will ask for help, but after that, they're on their own. And that's a goal, to provide the efficacy to the level where they think we can do it. We can do it ourselves. And the most important thing is you don't relapse to original behavior. With EFT, it's almost like a one-way street. Once you pass and go through the EFT, even introduction sessions, it's hard to go back to the previous place. There's also a lot of research that shows that EFT supports couples relationship, and a clinical wisdom that tells us that couples are special case. It's not that you're working with individual and their individual interpsychic work or interpersonal work, but you work with two people with two different aspirations, two different points of view, two different goals and needs and wants, right? And research after research shows that we can attend to these people, we can help them to recover from distress, we can help them to navigate through their life, and we can help them to build a strong family. Another reason that why EFT, because we're one of the only modalities that doesn't focus on content. And of course, content is important to start the conversation. Think of content as a catalyst. Just like you have a catalyst in your car that the gases come out, and by the time they go through catalyst, they convert into water, right? The content is a catalyst that allows us to start the conversation. The catalyst that allows us to find the place where we can enter into emotional experience. So yes, in the beginning, we will know what's the difficulty with clients and what happened, how did they get into fight, and what happened during the fight. But once we go through this and understand their interactional pattern, we completely remove ourselves from the content. And the only thing that we worry about and care about and focus on is to develop soothing interaction and maintain emotional engagement during the disagreement. Right? Not a content engagement, but emotional engagement. That means that the clients need to learn that in the moments of stress, in the moments when they feel that everything is lost, they can come back on emotional level and not get stuck and go into rabbit hole of the content. There's no solution to the couple's distress in content. The only solution we have is engaging, emotional engagement during the conflict. And that's what we teach them. That's what we do with them every single time. What we do is to help them to experience engagement on emotional level so that they can take that and generalize their experience in our sessions to their home, to their work, to their other locations. And the clients will come back and say sometimes, we came home, we tried exactly the same thing, didn't work. Well, of course, we need to practice, right? Normally it happens after first session. But even after second session or third session with couples, with conjoined session, I tell clients, don't try it at home yet. Because most of the time, if you try it at home, you will get hurt even more. You will have a bigger fight in your life than you had before. Because you learn just enough skills to become vulnerable, but not enough skills to help each other to recover from stress. Everything you need to do, we can do right here together. So we have 5 principles of EFT. It's all kind of based on attachment theory. So first principle is focus on emotions. And when you're with a client, and when you start talking a lot about other things than emotions, then you have to tell yourself wait. And the wait stands for acronym, why am I talking? And the way you need to answer to yourself, I'm talking because I want to focus on emotional experience. Then you're okay. But if you're talking about the content, chances are we're not focusing on emotion. So, and why do we want to focus on emotion? Because that's our driving factor. That's our motivational factor. That's what gets clients into the therapy. The second principle is growth and exploration. The goal of the therapy is to create growth. We want to have a healthy models of self as we look internally, interpersonal work, and a healthy model of other as we in between, as we look for externally to other people that we connect to. What we want to do, we want to create what we call secure dependency, not codependent, not independent, but effectively interdependent, or what we call secure dependency. And that's where the growth and exploration comes in play. Every session we see with our clients, we want to see a growth. We want to see more exploration of their experience and their emotional activation in the session. And we can help them to continue grow. The third principle of EFT is emotional balance. That means you can have emotions, but we are not going to go to excursions of those emotions to the level where the person you're with gets scared, right? So if we have an anger that's very strong, then your partner gets scared and worried. Emotional balance is a coherent and integrated sense of self, right? We can be models for others in a moment of stress. We can be calm. We can attend to our partner's needs. We know that because our partner will become also attentive to our needs. When we have emotional balance, we can attend to our partner, and we also can accept our partner when they attend to us. Because a lot of times in couples therapy, we might think that we're emotionally balanced, but in the moment of stress, it's all about us. It's not about the partner. We're the ones who need attention right away. But that means that we still need to do interpersonal work, that in the moment of stress, can I be in a balanced place where I can be stressed and still be available to attend to my partner, knowing that my partner can also be stressed and still be available to me, right? So that's emotional balance. We also focus on present experience. That's EFT principle number 4. A present experience means that we are present, just the way that we breathe one breath at a time. We cannot breathe in the future, and we cannot breathe in the past. We can only breathe in the present. The same way we work with our clients. No matter what we discuss with our clients, we're not going to process their distress in the past, because past is gone. We can't do any changes in the past. But what we have the power to take the past, bring the past into the present, create new emotional experience, and heal the past in the present. The same thing, we cannot do anything in the future, right? That's why we tell our clients, don't promise something in the future. Let's do it right here, right now. So when the client feels like they made a mistake or they feel some guilt, they may say something like, I don't think I'm ever going to do this again, right? So that's a promise for the future, but that's not staying in the present. Because future, you cannot sense the future in the present. You cannot experience connection with your partner by him telling what he or she is going to do in the future. The only time you can experience connection with your partner, it's in the present. So we stay away from this type of conversation of promises. We stay in the conversation that in the moment right here and now, I'm with you. I want to keep you safe, and I want us to be close to each other. Because that's what resolves distress, is having experience with a partner where they're available for you at the moment of the discussion, not a promise for the future. The fifth part or principle of the attachment theory is experiential map. Everything we do is experiential. Everything we talk to clients, we will experience it in the session. We will tell them in the session. We will help them to understand in the session. We have universal ways of formulating emotions and emotional needs. We know the emotions. We have the list of emotions. We understand what they experience. We also know what our needs are. We know what our innate needs are, to be connected and close. We know longings. So we can devise a strategies that will work for our partners, not to walk away from us, but to respond to us. Not to feel rejected or abandoned, but to feel loved and cared for and protected. Because we have this experiential map, one of the things we can do during the session, we can guess. we can guess and try out theories. Sometimes we conjecture into things that we think our clients experience. And if they tell us that that's what they experience, great, we guessed right, and that's fantastic. But if they tell us, no, that's not exactly how I'm experiencing this, then we can say, well, tell me what does it feel like for you? And what we receive is the accurate representation of their experience, and now we know where we are on the map. So it doesn't matter whether the client agrees with us when we guess or disagrees, both of them are beneficial. Both of them gives us the place on the map from which we can start working with our clients. So these 5 EFT principles, they're immutable. That means if you don't use those principles, then you're not going to be able to connect with clients. If any of them will be skipped, then you will get stuck with a client and will not be able to know how to proceed, right? So it's almost like this is our map. We focus on emotion. We focus on growth exploration. We help clients to establish emotional balance with self and others. We exercise and practice in session, in the moment, in the present moment. And we look at a map where we are and we know how to navigate through this map. That's our world. That's where we live every single day. So that's kind of covers the introduction to the EFT and the biggest question that we asked in the beginning, right? And that is, what is the nature of EFT? And as you can see, it's pretty straightforward. It covers a lot of territory, and it gives us the map and gives us the ability to find a way out with our clients out of their difficulties. And that's a key, because every therapist, when they walk in the therapy room with their client, they want to succeed. The EFT gives us a magic tool to succeed with our clients. And that's why I like it so much. That's why I think it's a fantastic tool. And with expansion of EFT into different areas as individual, couples, and families, that kind of closes everything up and says, okay, we have something. Now, we have other modalities that work very well in conjunction with EFT. So we're not going to be closed-minded and say that this is the only modality for us, but we're going to say that we can use EFT concept and understandings and views with other modalities. IFS is a good modality that works very well with EFT. You can introduce EFT components into the CBT, psychoanalytical work, somatic work, the sex therapy. All of them, for me, are sitting on the foundation of EFT, and you can put other modalities on top of that. Okay. It's really important to develop your own language and also know what language is, and that's a part of this work, is to develop this language. Because I don't think we're prepared for this language when we finish college. As much as we know what BBS wants and how it's kind of puts us all together and gives us this broad overview of all the different modalities and combinations. But that specificity a lot of times is missing. The goal is for us to become fluent in it. And part of the work is, given the situation with the clients, can we fluently navigate through it and have the vocabulary at our fingertips that will help the client to feel safe, connected, and engaged in this? Is the EFT language is staying with attachment framework. Attachment framework means that anything that clients brings up to you, we can interpret in attachment framework. Now, there's limitations. And limitation is especially if there's domestic violence, if there's anger, uncontrollable anger. Some of the things we should not be dealing with EFT, but use other methods to help the clients to recover. And a lot of times when things cannot be managed with EFT, I usually recommend either the group, to join some group, or to do some individual work before we can continue with the couple's work. Because for one person, being angry may feel like a normal state of mind. For the other person, it could be very damaging and hurting. So that's going to be that's a language we need to kind of help them to navigate and adjust. We don't want to change a lot. We want to change our clients maybe 1%, but that will create a huge change in the relationship, right? So if we look at any type of therapy, the outcome is always change. We need to make changes, right? So if we strip everything from the therapies, all the modalities, and go all the way to the base foundation, we see Skinner, BF Skinner, and that's reinforcements and how to help the clients to change. But the end results, it's always changed. What we found that EFT is the best vehicle for change. That's why it's so important. That EFT has a non-pathologizing, non-blaming, non-criticizing model that helps people to change. It doesn't have anything that would create distress in the couples or distress in the person, because it's very gentle and it's accepting. No matter what the client feels, no matter what they experience, we don't judge it, we don't criticize it, we don't try to explain it, we don't try to minimize it. The only thing we need to do is to accept that experience as their true experience. And only through acceptance of that experience will the client grow and become stronger. Right? We can't fight our way to clients' change. We have to accept them, invite them, reassure them, and validate them, and make sure that they know that they're accepted just the way they are. That we're not trying to change anything. I had